Welcome to Psych for Psychology, a Nystrom & Associates podcast. Our host, Brett Cushing, is a licensed marriage and family therapist at Nystrom. Each week, he talks about all things mental health and therapy with guests, and you get a chance to dive into specific psychology topics that help promote personal development and wellness. And now, your host, Brett.
Welcome back, everybody, to another episode of Psyched for Psychology. My name is Krista Overson. I'm a licensed marriage and family therapist. And actually, today I'm flying solo. I don't have my sidekick, Brett Cushing, with me today, but he is taking some well-deserved time off. So the exciting thing about this episode is that I'm here with Mary Anderson, who is a therapist at the Nystrom & Associates Hutchinson Clinic, Hutchinson North. So there's two. But I thought, she has a wealth of information and experience of working with children in therapy. And I thought, why don't I sit down with Mary and just kind of pick her brain a little bit? And right before we started recording, I already had some questions. So I was like, you know what? I'll just record and we'll just get going. So welcome, Mary. It's great to have you. Why don't you share, I guess, just kind of like, how long have you been doing what you do and how did you get into it?
Mm-hmm. So I have worked with children since I literally was 19. Well, wow. Before that I did babysitting, but my first career was childcare. So we owned and operated childcare centers for like 30 years. And when I was 40, we had a little kiddo in our childcare that needed mental health. But I could just see she'd already been kicked out of several daycares.
Yeah.
And I researched trying to get her help. And she was 3, and she would have needed to wait to even get interviewed for 9 months. I was like, wow, somebody needs to do this out here.
Yeah.
That, and we have a grandson that has autism, and that helped push me to how do we get services in the mental health realm.
Wow.
For children.
Wow.
So,
that's amazing.
Yeah.
So you care about what you do, and you always have.
I love it.
Yeah. Yes. Okay. So then, once you became a therapist, then what'd you do?
So, so the Lord had really laid it on my heart that we needed a clinic like this in Hutchinson. The goal was to have mental health, OT, which is occupational therapy, and speech therapy. Because when we would run our grandson to services, he had to go here for this and there for that. And so my goal was to have very family-friendly services in one site.
And I just want to add, before we started recording, Mary gave me a tour of the clinic, and there is a lot of stuff under this roof. Yes. There's occupational therapy. There's a play therapy area. Yep. I'm probably forgetting, but there's lots. So that was something that was on her heart, and here we are.
Yep. And we have a large outdoor area as well that we take to do therapies, some exposure therapies, just being able to get outdoors instead of in front of screens.
Yep. Nice. Oh my gosh. Even just you saying instead of front of screens has me like, I already have questions. So maybe I'll just kind of, jump in. So I used to work with kids more when I worked in Duluth. So I moved to the Twin Cities to continue to practice therapy in about 2016. But prior to that, I worked in a child and families program, and I worked with a lot of kids. And I will be honest with you, I got pretty discouraged. I just noticed that people are spending more and more time on phones and screens. And I'm not saying it's inherently bad, but I think one of the questions I've wondered or just would love your input and insight on is like, have you seen that be kind of an issue with devices and phones?
Definitely.
With the kiddos that you work with?
Yep. One of the things that I recommend to parents is that they use like a ticket program. If they are doing their chores and following family rules, they get, those really cheap carnival tickets. You can buy a huge roll for like $5.
Mm-hmm.
So if you have more than one child, you can write the child's name on the ticket so that brothers and sisters don't steal their time. And then the kids can earn like 20 minutes at a time on their devices instead of just nonstop device. Because what I found, even with my family, my grandkids, is if they're on it more than 30 minutes, it's super hard to pull them out. They get very aggressive about wanting more time. So it really feels like that 20 to 30 minutes is the sweet spot for being able to get them off of it onto
Sure.
something else.
Sure. Now, I guess I kind of jumped in with a really broad topic, but what you were saying kind of made me think, like, is that a typical reason why a family or parents might come in for therapy is like issues with screen time? Or is that just kind of a thing that's always going on?
Yeah. So I think it's one of the things that parents don't recognize, that kids come in more for like aggressive behaviors.
Okay.
And like oppositional things. But a lot of that, when I find out, is tied to two things.
Yeah. Sleep.
And screen time. So
okay, that's helpful, because I think a lot of times a family or parents will come in and they're saying our child is aggressive, our child is acting up, and then but they're maybe not at all aware of the impact of screens, right? Or sleep, or
Yes.
some of those other things.
Yeah, one of the things I notice about sleep is kids are not getting enough sleep. A lot of what we talk about is what time are they going to bed? Are they waking up during the night? And
Yep.
a lot of the issues stem, again, from those two things. Like they're either getting like unhealthy things that they're watching on their screen. They're just spending way too much time on it, so the body's not getting enough movement. So
Okay, so it's not just the sleep aspect, it's the physical activity aspect, right?
exactly.
Where kids are
Yep.
sitting to look at a screen versus
Yep.
being playing around and all that stuff. Well, actually, so that makes me think too. Do you think that, I mean, this is maybe like a whole rabbit hole in itself, but I know that there's a huge instance of attention deficit hyperactivity disorder diagnoses going on right now in kids. And so one of the things I wonder, and I can't really back this up with research yet, but I'm like, what is the impact of screens or of even tiredness?
Yeah, they're trying to keep themselves awake.
Sure.
And then, so I believe there's an ADHD component for several children.
Of course.
But what people miss often, and therapists, I believe, miss it, is early trauma. And I have a sheet. I couldn't pull it out for you right now, but it compares symptoms of ADHD and trauma. They're so close.
Mm-hmm.
And because people know more about ADHD, and because parents come in and say, I think he has ADHD, and the schools will tell you, I think they have ADHD. We treat the symptoms, and we don't get to the origin. Maybe trauma happened when they were 1 or 3, and that's why play therapy is so important.
This is so huge, because I know even therapists that kind of struggle with the trauma piece, not because they don't believe in it, but I think, like taking myself, for example, when I was being trained to work with kids, I don't remember getting training about how to find out about what kind of trauma happened at 1 year old, right? Yeah. And so you probably have to be kind of creative in how you figure that out.
Well, yeah, and one of the things that I have, my background is I went to the University for Infant and Early Childhood Mental Health.
Wow.
That was a 2-year program.
There you go.
That talks about attachment. It talks about early trauma. It talks about how we get kind of to the root. Mm-hmm. And so a really broad thing I can say for therapists is it's super important to get a timeline. When they find out they were pregnant, could tell you incidences of kids that were in utero when they had their trauma. You want anything that happened with this child, any car accidents, any deaths in the family, any separations, any moves. Moves are a trauma for kids. I describe that like this. If you go to a hotel and when you wake up and you have to go to the bathroom and you're just kind of disoriented. So kids that move get that. So we're adults, and it still takes us a few seconds to where am I? What am I doing here? So when kids are moving often, they're kind of living in a sense of not knowing. And for everybody, that's so important. So that would be a foundational thing, is just those early traumas that we probably don't think of as trauma. For kids, they're traumatic. Really getting a thorough timeline of this child's life. And I say child, but I do this with my adults as much as I can. Because what we want to do is think back. So I had a kiddo that was on my caseload that was 5. Did a timeline. And about 3 months into working with him, Mom says, oh, by the way, did I tell you when he was 18 months old, he walked off the end of a dock? The reason this child was referred is because public health was seeing that he would climb to the top of their kitchen cabinets and jump off. They were in a split entry home. He would jump from the top. He was about 4 at the time when I started. He would jump from the top down to the bottom. And he would always be like, look at me, look at me. His mom mentioned that in our therapy room. The child stopped and looked at me like, all right, now we know.
Whoa. So, okay, so he was 5 when he came to you?
He was about 4. He
About
was 5
4?
when I was done with him.
Okay, but
Yeah.
and then at what age was the doc?
18 months.
Wow.
So he had no words.
Nope.
He couldn't say, that was really scary. So he was showing it through his actions.
Right.
Like, he fell off of something high, didn't feel safe.
Yep. Yep.
And the family at the time, you know, it's hard because you see your 18-month-old bobbing.
Yeah.
But they waded through the water to get him instead of running down the dock. So I'm sure the amount of time was longer than what it needed to be. And then the fact I'm like, so did you bring him to the hospital? No, he was fine after we pulled him out. It's a little into our hopefully next topic.
Yes,
about
exactly.
Early childhood mental health.
Early childhood mental health, yes.
I'll finish that a little bit.
Please do.
When
Yeah.
we go there.
Perfect. Okay, this is your teaser for the next installment here, because this is so important too. And I love that you mentioned about that you will ask your adult clients.
Yes.
And do you do the timeline of like even back from when their parents conceived
them?
them?
Get information from the parents, because what we know is they're seasonal. So out here in rural Minnesota, we find with adults is adult women mostly. If they grew up in a farming family, spring and fall are trauma triggers for them. So any of you therapists out there, if you have somebody who was raised rural, I would really dig into that, because most likely spring, when it's planting, things are super stressful around the home. Or maybe there was an accident with a sibling or a parent. Fall, harvest, same thing. Yep. So these people feel like they have this cyclical depression where really it's trauma that was really early rooted in the seasons.
Okay, so you're basically, if someone might be mistaking a seasonal depression for a seasonal trauma.
Yep.
Which again, I think is so important, because that's a piece of the trauma work that I think is less talked about even among therapists, right?
Absolutely.
And they're just like, oh, it's seasonal affective disorder, and that's the more well-known, right?
Now, the interesting thing is, as I worked with these ladies, and sometimes what happens, because I work with kids, but then I work with the parents. So early childhood's very dyadic. So
sure.
We're working with the mom and realizing why she's having issues with this kid in the spring and in the fall, where really it's mom has these trauma triggers from spring and fall. And the difference with seasonal affective, it usually starts after the fall harvest and it ends before spring. And so that's a really good way, too, to look at it if you're looking at seasonal. Because it's typically in the winter when people have that.
Sure.
So it can get really confusing, but to really tease that out is super helpful. Because when you've got an adult client that's like doing really well and then they just dive during a certain time of year.
Yes. Pay attention.
My best guess is you're going to be able to tie that back to a trauma earlier in life. So we call those small T traumas.
Exactly.
Which most people just kind of glaze over. Like, oh, it's not a big deal. Depending upon how supported you were, how many people you can share that with is how much it deep seats within you.
Yes.
So
I'm glad you mentioned that distinction about small T trauma and big T or large T trauma. Yeah, because I think that's another just good like trauma 101 piece for people. It's like, because I've heard other therapists and even just other, people in my life say like, well, not everything can be trauma, right? And it's like, well, there's so many factors at play, like you were saying. How much support did you have? What belief did you take on?
Let me give you another story.
Perfect. Thank you.
I got
yes.
Lots of those.
Good.
So
that's how I learned best.
that they brought in.
Okay. A 9-year-old?
Behavioral.
Okay. Yep.
And I did the whole timeline thing. And this event wasn't disclosed because to mom and dad it wasn't a big deal.
Okay.
But what had happened with this kid that I finally figured out at about age 4, he was still in the car seat. He hadn't seen his dad for a long time. They were divorced. And so he was starting visits with dad.
Okay.
Dad was an EMT. Mom lived in Silver Lake, which is like 7 miles from Hutch. And dad went to Silver Lake, picked the child up. On the way back, there was a car accident. This child and dad were not in it, But because Dad's an EMT, he pulled over to take care of that.
Yep.
This child who was already nervous because he hadn't seen Dad for a long time and was going for an overnight with Dad.
Oh, yep.
Is in the car seat as there's fire trucks coming and ambulances coming and nobody's in the car with him. So fast forward 5 years,
yeah.
and this kid has this deep-seated trauma that nobody even could tell me about. He could play it out in my room with
wow.
the ambulances and the police car and crashing cars. And then I had to pick Mom and Dad's brain. Like, he's seen something, anybody. And Mom was not aware of it because she wasn't there. Mm-hmm. Dad wasn't aware that it was a trauma because he was just trying to help. And so that's kind of how some traumas happen, is they don't have a foundation of safety. And all this stuff happened.
Yep.
So in this kid was this fight or flight. Like, I got to get out of here. This is dangerous, but I can't, and nobody's here to help.
That's amazing. And several things about what you said about that, but that, you know, with the play therapy, right, is that no one could, for a long time, it sounds like no one could articulate that story and explain it. Like,
no, because they didn't thought it was a big deal.
There you go. They were like, well, he wasn't the one in the car accident. Like, he was in the car and his dad went to go help, right? Yep. So so
Dad's all excited about having this kid for the weekend, so he's not
thinking of it that way.
He didn't think of it at all.
Right,
he was
exactly.
Like, oh, buddy, okay, it's time to go. Let's go have fun. And so now this kid had to put a cap on all these feelings.
Sure.
Never got to share those.
And so from there, so you put a cap on the feelings. I'm kind of putting myself in this kid's position, right? Like, doesn't really know how to make sense of what happened, but has that fight or flight response. And so you said it was 4 or 5 years later. What was starting to manifest in terms of behavior?
I got him, and both Mom and Dad at that time in schools reporting, like, he just can't behave. He can't sit still, listen to family rules. He's really, like, oppositional. If we tell him to do something, he won't. Wow. So now what we have is we have the original trauma, and we have a self-esteem issue because this kid can't do anything right, and he's just acting out of his stuck trauma.
Yeah. But then, like you said, so that we have the initial incident that happened, but then if he's unable to regulate himself and sit still and behave, like, then it piled on top. You were saying, like, now he feels just crummy about himself, right? Like, I can't do anything
in school because he's nervous. So, but it has nothing to do with ADHD.
See, and
it's trauma based in the body.
Okay, so that's back to what we were saying about, yes, are there kids who have ADHD? Absolutely. Yes. And look at how it can appear very similarly, right? Like, can't sit still, can't, always moving around, getting up and all that stuff.
So then we tend to try to medicate that. And that's why sometimes medication doesn't work.
Sure.
Because that's not what it is.
That's not what it is. Yeah.
It acts like that.
So just to kind of I want to keep going with, if you're okay with going with this example for another minute. Sure. So he's gotten into services, you're working with the family and working with him. He starts to at some point kind of play out what happened using the toys, right? The ambulance and et cetera. So then from there, how did you help him process that?
Yeah. So what we do is we bring the parents in and we talk about, again, I had to find out, like, really digging, like,
from them.
Happened.
Yes.
And then the dad was able to say, well, when I was bringing him home, and then they got to talking, and the timeline was the first time he was able to see him for the weekend. And so that adds to that traumatic piece.
Sure.
He doesn't really trust Dad yet. Now we've got this.
Exactly.
So,
oh my gosh, good point. Yep.
Yeah. So just so many factors. And so got them talking about it. And then both Mom and Dad reported to me, now he talks about the accident all the time. And I said, yeah, let him. Because if you're ever in a car accident, the first person you tell is like, oh my gosh, I was in a car accident and this happened and this happened. And and then the more you're able to tell it, it's like, yeah, I was in a car accident, it happened at this. It dissipates it. When it's stuck and you can't tell anybody because they don't understand. And when you're 4, and now you're 9, you're like, did that really even happen, or did I dream that? But now you have affirmation.
Yes.
And now you can go with it. It took a while to help him out of that because of all the residual things that happened behaviorally.
Sure.
And in school, he felt stupid. He's not stupid. He got his trauma out of him, and then his grades just soared.
Isn't that something?
Yeah. So once you can really root out what actually the root of the problem is instead of just the symptoms, it's so helpful.
Well, and again, that's such a such a good example of the magic of play therapy, which I don't have extensive training in, but some of the therapists at our clinic do, and I know you do. And just because how would he have been able to convey that to you otherwise? Or how would that even have like been a point of interest where you're like, I think I need to dig into this, right?
Right.
With because for those of you who have never seen a play therapy room, they're just so incredible. They're stocked with all sorts of different toys and figurines and cars and like specifically for that reason of, you know, there's one thing I never really understood about play therapy rooms, and we revamped ours last year and I learned a ton, is like there's things you like have to have in there. Like it's not just like so again, just kind of, you know, clarifying when people think about therapy with kids, it's not just, oh, they're going to go play in a therapy office. It's very, very intentional.
Yes, and we don't call our toys, we call it equipment. I had a little girl one time that I had to say, okay, so we're almost done.
Mm-hmm.
And Mom said, okay, put the toys away. And she stood up, and this little girl was almost sweating because she had been working so hard on her trauma. And she goes, this is not fun.
Okay, so it's not toys and playtime and fun
equipment.
time. Yes, it's equipment.
And they work hard.
Yes, and just the image you just shared about, I just, like, it kind of gives me goosebumps, you know, like she had been working so hard because that's what they're doing.
Yes.
They're working through, and their little bodies, like you had said earlier, have been storing that experience and that trauma. So to be able to play it out is like the way that it's like their version of verbalizing it.
Play is children's language.
Yes.
And so if we think of it that way, that's the way they speak, and instead of them saying this happened to me with words, they play it out and play it out and play it out.
Right, exactly. And so then a therapist with a trained eye can see, okay, what was the equipment that they gravitated to, right?
Yes.
And then the ones that they continue to use. So, and just kind of back to the example of the kid that was climbing up was it on top of the fridge and jumping off?
Yeah.
I mean,
the cabinets.
Again, I think that could so easily be misconstrued as, you know, so-and-so has a behavior issue and so-and-so is just being naughty. But I love that. I think, again, the therapist, a really good therapist will get interested in that. They'll be like, okay, what's the significance of the climbing up and jumping off? Like that, yes, kids run and play and jump, but like the repeated, like to have the ability to kind of be like, wait a minute. This is a very specific action this kid is doing, right?
Absolutely.
Right.
And so when they do, and that's the way we tell in play therapy, whether it's just play or it's trauma play, is they do it repetitively. And they're very pressured. That's the word. It's repetitive.
That's great.
So often what my kids will do that are really into their trauma play is I'll greet them at the waiting room. And if I have to say a few things to the parent, by the time I get back, they have all their equipment they've picked out everything they're going to use. This just happened this past week. I hadn't seen this little girl for like 4 months because of scheduling things on the family side. And she got back to the room before we did. And I say we because I have an intern that's following me around right now. Yeah. And she gets back and she's like, all right, you're on the couch. You're here. She gave us our equipment and we just started right 4 months ago.
Wow.
We literally continued right where we left off 4 months ago.
That's incredible.
So this was held in this girl's mind.
Yep.
Like she had it planned what she needed to work on.
Well, and that, I think that is so powerful too, because it sounds like I'm kind of making maybe a leap here, but kids, it sounds like kind of know what they need, right? Like once you give them the setting and you give them the equipment and you give them the area to do this or the space to do it. Yes, it sounds like their little brains and bodies are just like, okay, I know what to do.
Absolutely.
Which is beautiful. Yeah. I mean, I got
another little girl that I saw yesterday, but she will walk into the playroom, walk over her equipment she uses is Winnie the Pooh, Tigger, and Piglet. So she will scrummage through that little bucket of, so she's got her people, and we're ready to go.
Nice. Yes, exactly. So, and I tell people the same even when I'm working with adults. When when I'm trying to explain to them about trauma work and EMDR, which is another episode you can go back and listen to, people get a little bit nervous about, okay, am I going to do this right? And I always say your brain knows how to heal itself. And so once we're just giving it the protocol and the tools, and your brain's going to like do it. And
I can't wait to get to our early childhood.
I know. It's going to be great.
There's so much developmental stuff that we can do in play therapy that helps early trauma that we don't even aren't aware of.
Ooh, this is going to be good, you guys. This is like the trailer for the feature film, right? But I really appreciate this too, because Mary's kind of just allowing me to ask different questions that pop into my head about this. But I think it does give kind of a good overview of people who may have really no idea what goes on with children and therapy. And I'll be honest, I used to be, before I really worked with kids much, I used to be sort of skeptical, kind of like, well, what are you really doing? And I actually had, my supervisor was a very hardcore family therapist. And so she always was kind of like, you shouldn't ever be working with the kid by themselves. It should always be the full family system, which there's merit to that as well. But I think
that's true for early childhood. We always have.
Right.
I mean, 98% of the time, unless the parent is really dealing with their own mental health stuff and it's not a safe environment for the child to play things out, we would have the parents in with early childhood.
Okay. I'm glad you mentioned that. Yeah. So like for some of the kids, like even the 9-year-old, did you have the parents there with, or?
No.
Okay. Not right away.
No.
And
often with the older kids, I don't.
Yep.
Because a lot of times they have things to play out. So especially if moms and dads are divorced, this is their place that they can play out how they really feel without worrying about how they're affecting the emotions of their adults.
Wow.
And lay it all out in their play. And some of the things we see in play, it's amazing. Another little child, I'll just think about this little kiddo. He would pack all the adult people into the bathroom in the playhouse. And I had no idea what that was about. And then the kids would be hanging off the roof, which is a sign of not feeling safe and feeling unstable. And he would line the kids up either on the roof above this or on the floor. And mom finally got out of treatment, so she was able to come in sessions.
Yes.
And the first day she saw him play that out, tears. Because the adults in her world would all go in the bathroom so the men could take the smoke from the marijuana and things out. As the kids are all out there just doing their own thing. And he was able to show us how unstable and how unsafe that felt. And she knew exactly how to interpret that, where I didn't.
Right. You noticed it, right? It like caught your eye. You were like, this means I know this is something. And then but he had to have that space. I think your point too was without any parent there. Right. Because if mom had been there for that first one, it might have been like, well, I'm not going to really.
Or she might. We've had very many people that like wouldn't bring him back. So I had a 4-year-old make a mixed drink in front of dad. He literally, I have some little alcohol bottles that I got off the airplane, and I have orange juice and cups and spoons. Wow. He got everything out, set it up, mixed it, took a drink, and then staggered across the room.
This kid did?
Yes, 4 years old.
Wow.
And we never saw him again because it was too close for dad. And dad didn't bring him back.
Wow.
Because it would reveal what was happening in the home.
Man, so many powerful examples. Wow. Well, now you guys have to go and you have to stay tuned for the next episode because we're going to dig in more on early childhood mental health. But for today, I think we'll kind of wrap up, and I am so grateful to have been able to talk with Mary about this. She's a wealth of information. When I first met Mary, we were in the same kind of region for our different clinics, and I like kind of glommed onto her because I was like, this person knows she knows what's up. I need to, because I supervise therapists who work with a lot of kids, and I just I could see right away she knows her stuff. So
I love it.
Yay. Well, thank you so much, Mary. And we will see all of you on the next one on Psyched for Psychology.
Thank you as always for listening, and please be sure to leave us a review. While this podcast can't be a replacement for therapy, we hope you enjoyed our discussion today and join us again next time. Nystrom & Associates is always available to those who are struggling. If you find yourself in need of support and help, please check us out at nystromcounseling.com.